In today's current society, mental health is a huge topic that isn't really addressed. People aren't as aware about it, people don't understand what entails a mental health issue, and anxiety is one of those big ones that isn't really understood. Anxiety is a feeling of unease, apprehensiveness, and worry that people feel before some type of event, such as a job interview, first day of school, meeting with someone for coffee for the first time. But anxiety can take on a whole different level when it develops into an anxiety disorder. And anxiety disorders are characterized mainly by that normal anxiety, but to a whole different level. So that worry becomes excessive, that fear becomes severe, and just those feelings that are associated with anxiety take on a whole new level and power. Anxiety related disorders, the fear doesn't go away and it lasts for weeks, months, and becomes part of your daily lifestyle. And anxiety disorders are actually one of the most common illnesses in the US and affects about 40 million US adults 18 and older. They're highly treatable though, and the only bad thing about that though is that only 36.9% of individuals with anxiety disorders do seek treatment, and that's mainly because they're either embarrassed about having a disorder, or they don't know they have a disorder, or they think they can handle it themselves. And people with anxiety are actually, in fact, 3 to 5 times more likely to go see a doctor when they acknowledge that issue, and they're 6 times more likely to be hospitalized for psychiatric disorders. And anxiety disorders are usually developed by some risk factors such as their genetics, their lifestyle, family history, brain chemistry, or their personality. To understand anxiety for those who really don't get it that much, let's talk about the APA definition of it. The APA defines anxiety as an emotion characterized by feelings of tension, worried thoughts, and physical changes, such as an increase in blood pressure. From a scientific perspective, though, anxiety is a body's natural response and its response to stress. So it's the feeling of fear that the body creates to protect themselves. But with anxiety, it differs per individual. So I could feel anxiety a whole completely different way than you could feel anxiety, or my boyfriend feels anxiety. Who knows? But that's the really hard thing about it when diagnosing it, is that everyone feels it in a different way, and that makes it very difficult. Anxiety usually feels like you're being closed in on, you really feel trapped, and your heart feels like it's going to pop out. That's like the main general symptom of it. And anxiety disorders occur when a reaction occurs out of proportion. So a small situation that you can feel slightly anxious about becomes catastrophic. So if you miss a phone call and you start worrying about it, that worry takes on a whole different level and kind of corrupts your mind and makes you feel like crap. And it's actually the most common emotional disorder, and it can affect anyone at any age. So you could develop it when you're 40, 50, who knows when. And according to the APA, women are more affected than men with anxiety disorders. But anxiety disorders can be treated with psychotherapy, medications, or even a combination of both. And there's 6 types of anxiety disorders. The first one is general anxiety disorder, where you feel anxiety on a daily basis with no probable cause. It happens for no reason. Second is panic anxiety disorder, where you struggle with panic attacks that happen in intervals of like 10 seconds to minutes and can happen several times per day, and you're usually caused by a trigger. Third one is a phobia, where a certain object, event, or thought or idea triggers you to have anxiety, such as arachnophobia. Social anxiety is the next one, where you are constantly filled with the fear of humiliation, not making friends, or being humiliated in public, which kind of leads to people being antisocial. Next one is OCD, obsessive compulsive disorder, when people are obsessed with this thought, and if they don't complete the action, they're going to feel anxious. And then the last one is PTSD, where a previous event in your life has caused you to feel anxious and carries on to your daily lifestyle. With anxiety, there's several risk factors that lead you to having one, such as your genetics. 30 to 67% is hereditary, and it actually does run in families. And also parenting behavior can lead you to developing an anxiety disorder. So if you have like very authoritative parents, that can lead you to developing one. And the thing with anxiety is that you can be treated for it. And the main treatment for it is psychotherapy, where you go see a therapist and you develop techniques to help you deal with your issues. The second is medication, which is great, but there's also negative side effects, as we all face with typical medications. And the last one that's new and progressive is complementary and alternative therapies, such as stress techniques that help you deal with it. Yoga and also working out can help you. But anxiety is a huge thing that needs to be addressed in society, because people don't really understand the difference between casual, regular anxiety and an anxiety disorder.